Hi folks, I'm Dr. Tom Meade. Welcome back to Truth in Medicine, our second episode. It's actually a two-part episode of the diabetes history in the United States, where it went wrong, how it gives us the answer to the obesity epidemic, type 2 diabetes, even the cholesterol scam, and the statin revolution. I'm going to tell you how you can take back control of your health. Why would I, as a knee surgeon, be interested in the history of diabetic treatment? I'll tell you why. If 2/3 or 3/4 of the country is overweight or obese, 80 to 90% of all my knee patients are overweight or obese. And you know what? Every commercial insurance carriers looks at my patients, every total knee patient, they look at their weight, their BMI, and they look at their hemoglobin A1C. The reason they do that is in some ways to decrease complications and help the patient optimize them medically, but in other ways I'm not so sure. It may be to deny or delay surgery. So it behooves me to understand obesity, blood sugar, and diabetes, how we got here. It also unlocks the key to weight loss, the treatment of chronic disease, and to navigate the cholesterol scam, and perhaps how I can help my patients live longer or live better. Those are two principles every medical intervention should address. Every patient, whether they're starting a new drug or recommended another procedure, should ask themselves two questions. Am I going to live longer? Am I going to live better? If it doesn't answer those questions, they shouldn't do it. I interview a lot of patients about knee surgery, but recently I'm fascinated by the obesity epidemic and how we treat obesity in this country, how little some patients know, and the information they get from their providers. Let me show you this quick video of a patient I've interviewed recently. All right, I'm John Guido here. He's retired policeman, respiratory therapist, active guy, cyclist, wore his knees out. He's here. We're going to do our outpatient total knee resurfacing. That's not why I'm going to ask him some questions. He hides it well. He's carrying a bunch of weight on this body, and I'm always interested in our medical system and how we've treated this. So, John, have you been overweight for a while?
Yes.
So how long?
Oh, probably the last 15, maybe 20 years or so.
Oh, really? How often do you get medical checks?
I go every year.
Every year.
See the family doctor.
Once a year, correct?
Yes.
And they do blood work every year?
Yes.
And do they check your blood sugars?
Yes.
And do you know what hemoglobin A1C is?
Yes.
What is it?
It's about 10 or 12, isn't it?
But what is it? What is a hemoglobin A1C? Do you know what it is?
It measures the blood, and is that the clotting factor part of it?
No, it's the one that shows you what your blood sugar has been for the last 3 months. So it tells you if you're pre-diabetic or not.
Okay.
So were you ever told you're pre-diabetic?
Yes.
For how long?
Many years.
Many years. And was there a concern about that you're going to get diabetes, or were you and your doc happy that you were pre-diabetic and not diabetic?
I think he was more happy I was pre-diabetic and the numbers were staying the same and not changing at all.
Right.
And they were just monitoring them every year.
Great. And so do you know what insulin is?
Yes.
What is it?
It helps to regulate the sugar.
Correct.
In your body.
Did they ever measure your insulin that you're aware of?
No, never.
No. Did they ever talk about it?
No, never.
Did they ever talk about losing weight?
Yes, all the time.
And how did they tell you to lose weight?
Diet and exercise.
Diet and exercise.
Constantly, every year.
Would you be surprised if I told you diet and exercise will not lose weight?
Well, our conversation that we had, yes,
Is that surprising?
Yes.
Because your whole life you thought if you diet and exercise,
yes.
But if you don't have the tools, you could exercise. How if I told you could exercise till you're blue in the face, and you can diet, but you're not told how to diet, you will never lose weight. Does that surprise you?
That opens my eyes.
And would it surprise you that even though your insulin was never measured, that I could tell your insulin is sky high? And do you know what the other name for insulin is?
No.
A fat storage hormone.
Okay.
Do you know why it's called that?
No.
Because it stores fat. So it really doesn't lower your blood sugar, it hides it and it turns it into fat. So if your insulin's high, you'll never lose weight. So the reason you can't lose weight is your insulin is sky high. And do you know how I know that?
From what you explained to me.
Yeah, so I could look at your lipid level and your triglyceride to HDL level is 5-to-1. It should be 1-to-1. Anything over 2-to-1 means your insulin is high, even without measuring it. So you will never lose weight unless you lower your insulin.
Oh.
Was that ever told to you?
Never.
No. And do you know how to lower your insulin?
No.
Now we talked about
I know we did talk
you have
about
to
it.
lower your carbs.
Yes.
So I'm the knee guy and I'm fascinated by this, and we will measure your insulin level before we do your total knee resurfacing. I will give you that information. Does this education help you and change your mind?
100%. I was told always, I wanted to measure my testosterone level. The doctor said, no, you don't have to do that. Then through the VA, another doctor referred me to it's called the MOVE program that they have. And it's all about nutrition and diet. And it was just basically the same thing, diet and exercise.
It's insulin. The answer is insulin. And it was never measured. Do you know what it costs to get an insulin test?
No.
$20. Does this surprise you? It was never done?
Yeah. Why?
We'll get
Okay.
it. Within a week, you'll know your insulin level. And we're going to improve your health besides doing a knee replacement. We're going to look at your metabolic health and improve it. How
That would
about
be
that?
great.
Is
That would be great.
We're going to help you lose weight.
I know when I would drop weight, energy just comes back
You'll do
and you
it.
feel great. Okay.
All right. Thanks.
Perfect. Thank you.
So it fascinates me. I have dozens of patients like this. Fascinates me how little they know and the misinformation they get from everybody, including their providers. So let's look at the history of how diabetes was treated for the last 100 years. And if you watched our first show, we're going to apply the same principles that we use. We're going to look at and question published research on diet, sugar, insulin, obesity. We are going to look at the big pharma influence, drugs versus lifestyle. We're going to see how selective statistical data was manipulated to help promote a false narrative. We're going to look at how so much misinformation was disseminated by not only our medical groups, but our government, and how singular individuals like Ancel Keys have controlled the narrative for over 100 years. I'm going to fast forward to the answer. You don't have to watch the whole show. This is the answer. Insulin is the key. Insulin is the key to obesity. It's the key to weight loss. It's the key to heart disease or cancer. It's the answer to sickness or health. So stay with me and I'll explain that a little further. We're going to look at the timeline. We're going to look at milestones of the history of diabetes going back 200 years before insulin was discovered in the 1920s. And then a critical time in the 1950s where somebody called Ancel Keys came along and flipped the whole script on our healthcare treatment for the next 70 years. We're going to look at how the American Diabetic Association, the American Heart Association, the food pyramid, U.S. government regulations helped start the obesity epidemic and initiated chronic disease in this country. We're going to look at what happened between the 80s and current time, and now we're going to dive into the GLP-1 solution. I remember when I was a kid and our parents would say, don't eat too much sugar candy, you're going to get diabetes. And of course, we thought that went away, but it didn't. It's actually true. Let's look at some of the observations a couple hundred years ago. 1797, Dr. John Rollo, a Scottish doctor, said excess saccharine matter or sugar is common in diabetes. We should use an animal diet. It became the standard of care to treat diabetics for the next 125 years. In the early 1800s, the average American ate 1 teaspoon of sugar. That increased to 20 teaspoons by the late 1800s. And now it's estimated somewhere between 70 and 100 pounds of sugar are eaten per capita in the United States. That's 1,000% increase. Do you think that contributed to obesity and chronic disease? I do. A leading British nutritionist, Chambers, he said, allowing diabetic patients to eat starches and grains could not be justified. It's actively harmful. A British undertaker looking at obese people who have died, he decided to write a weight control booklet. It was famous. It was called The Letter on Corpulence. Simply give up bread, milk, sugar, beer, and potatoes. William Osler, 1893, father of modern medicine. He said carbohydrates in food should be reduced to a minimum. They all caused diabetes. Limiting carbohydrates benefit many and cured some. Jocelyn, known as the father of diabetes in the early 1900s, said the only chance a diabetic has for life before insulin was his ability to eat fat and limit or eliminate carbohydrates. In 1913, the evidence showed that diabetes was greatest in societies that consumed the most sugar. This was rejected, of course, by doctors and diabetologists. Diabetes was very common in sugar refinery workers. It's not rocket science. It's just like coal miners develop black lung or asbestos workers develop mesothelioma. You just have to look. It's not that hard. This book deserves its own attention. It was a French attorney. I can't pronounce his name. But in 1825, he said, I know what causes diabetes. Just talk to the fat people. They eat too much starches, sugars. I love the potatoes. I love the rice. I love the bread. Since then, it's sort of institutionalized that carbohydrates and starches cause diabetes. So back then, we didn't have a lot of science, a lot of prospective randomized studies, but what we had was common sense. We knew nothing about diabetes, insulin, or the cause, but we had common sense and we could observe things. Diabetes is a fatal disease. Unless they changed their diet and eliminated carbohydrates and exist on a high-fat protein diet called the animal diet, today known as the ketogenic diet, it's taken us 100 years to relearn, and it's still not the gold standard. All right, let's look at what happened from 1921 to 1960. In 1921, insulin was discovered by Fred Banning. It was called, and Best, it was called a miracle drug. This was a titanic change. We changed from diet versus disease before that to drug versus disease, and we never went back. Diabetes was not cured, but it allowed patients to eat whatever they wanted, a non-restrictive diet. Banning advocated that. He discovered insulin, and he said now patients can eat whatever they want. We just have to cover it with insulin. It was easier for patients. It was easier for physicians. Given the choice, they thought patients would choose drugs over a restrictive diet. Physicians assume most patients prefer drugs no matter the side effects. Does that sound familiar? It almost sounds like the theory behind GLP-1 drugs today. You know, diabetes increased in America between 1920 and 1960. The more they consumed sugar, the higher the diabetes, except during World War II. And why was that? Because we rationed sugar at that time. There was no consensus on the correct diet because the focus was on drugs. It was on newer insulin, newer formulations, and newer oral agents. And at that time, there was no differentiation between type 1 and type 2 diabetes. So for 40 years, we didn't know the difference. But you know what they knew? They knew insulin makes you fat. Emaciated patients given insulin soak up fat like a sponge. They actually applied this to other patients, premature infants. If they gave them insulin, they got fatter. Anorexic and other wasting diseases. If you gave those patients insulin, they put on weight and they got fat. They told people that if you were fat, you're going to get diabetes, but they really confused cause and effect. Fat people in reality are well on their way to diabetes. It was due to increased insulin resistance and increased insulin. That's been going on for a long time. Insulin stores carbohydrates as fat. It stops the release of fat from your cells. I always tell patients, it doesn't really lower sugar, it just hides it. It puts it in our fat cells, it puts it in our liver, it puts it in our muscles. It actually deposits it in our arteries. It puts it around our visceral organs. And as long as insulin is high, it locks the fat in and you won't lose weight. Even in the 1930s, they knew it was impossible to lose weight on a high-carb, high-insulin diet. It didn't matter if you had type 1 or type 2 diabetes. It's the same today. I see this in my office. You'll have an overweight woman, and she says, I don't eat much. Just ask my husband. But I can assure you, at some point, it's due to insulin. Insulin is the most lipogenic hormone in our body. You don't get fat without insulin. Something happened around 1960, and that was Ancel Keys entered the stage, and insulin could be measured with a radioimmunoassay. So I'm going to hold that thought and come right back and explain that. We left talking about the 1960s when someone called Ancel Keys entered stage right, and we had a new test called the insulin radioimmunoassay. Let me talk about that first. So that was a test where we could finally measure insulin. For 40 years, we didn't know the difference between type 1 and type 2 diabetes. But what we did know is that with increased insulin, you got the same result. If you had an increased carbohydrate diet, you had increased insulin, whether it was injected or your pancreas produced it. Excess insulin is bad in both. It affects every cell in your body. Lowering sugar is only one of hundreds of effects of insulin. But often patients and even providers think that that is all insulin does. But think of insulin really as one of many molecules and hormones in the body that work in concert. It's almost like a symphony, and they all have to act and react to each other, just like every hormone in the body to maintain homeostasis. If one of those molecules or one of those hormones is off, it's like one instrument playing very loud. It disrupts the whole symphony, the whole song, and that's exactly what happens. If you have insulin playing all day long, it's like a loud instrument ruining the whole symphony. As we said, it's the most lipogenic molecule in the body. It creates fat, it deposits fat. Obesity is a hormonal issue. I was wrong my whole career. I thought it was just too much calories, lack of exercise. It's really not. It's eating the wrong kind of food that increases a hormone called insulin that causes obesity. And you know what? Like we showed in the video, we never measure insulin. It's almost rare that I see in a patient when I look at the annual test that they get that their insulin is measured. I measure it on every total knee patient. You know what an insulin test costs? $20. It is crazy not to measure this. Okay, enter Ancel Keys, 1950s. This man, who's not a physician, he was a physiologist, he single-handedly created what was called the saturated fat, cholesterol, heart disease hypothesis. And this was after World War II. There was sort of this concern. We were seeing more heart disease, more heart attacks in the country. And he thought he had the answer. He looked around the world and he saw different diets and different cultures. And he thought in those countries that had increased fat in their diet had higher heart disease. So he went on a 22-country tour, and he evaluated, although a low number of patients, with his wife, who at the time could actually measure cholesterol. It was a primitive test, but they could measure only total cholesterol. And he produced a famous flawed study called the 7-country study. Out of 22 countries, he only measured 7 where it looked like they ate increased fat and it caused increased heart disease. It was a classic example of research bias. He excluded 15 countries that didn't agree with his theory. This was one man, one study, who had a dominant, aggressive, pervasive personality that negatively influenced healthcare for the next 70 years. He convinced the American Heart Association and the medical community that saturated fat in your diet caused heart disease. Many still believe that today. He was the only non-physician placed on the American Heart Association Nutritional Committee. Who was in conflict with that was the American Diabetes Association. They had worldwide scientists and observations where diabetes and heart disease was linked more to carbohydrates and not to fats. But at the time, the American Heart Association was very powerful. Ancel Keys was a very persuasive individual, and they gave in. They acquiesced to the American Heart Association because a lot of the diabetic patients also died of heart disease. So they flipped, they went along with the American Heart Association, and they actually went to the point where they were recommending 50 to 60% carbohydrates in the diet. And the world followed. Obesity is a disorder of excess eating. It was not an insulin hormonal dysregulation. It was basically a willpower issue. This was crazy. This is comparable to recommending smokers smoke more cigarettes, which is the root cause, and saying, don't worry about it, smoke all the cigarettes you want. We'll just develop better technologies. We'll develop portable oxygen machines, different medications. You can take inhalers, steroids. We can have surgical procedures like tracheostomies or lung resections. But it sounds crazy, but that's essentially what it was like for the American Diabetic Association to recommend 50 to 60% of carbohydrates. Every time I mention carbohydrates, mention the word insulin, because that's what happened. Even more flawed information in the 70s came out. A very important seminal article. It was called The Analysis of Failure, Diet Treatment of Diabetics. They basically said, we give up. Patients are unwilling or incapable of following a restricted diet. The burden of a restrictive diet is not worth the benefits. Does that sound like the GLP-1s today? Possibly. But the blame was complex. Back then, physicians had limited knowledge of dietary principles and strategies. They really underestimated the role of a diet to actually mitigate or reverse diabetic complications. And really, the same might be true today. I think physicians know a lot more about dietary principles and strategies, but maybe there's other forces at work. Maybe they're too busy. They have 5, 10, 15-minute appointments. They don't have time to educate patients in this regard. But there are some programs that do that, and I'll touch base with that in a little bit. Basically, we picked the wrong horse in 1971. The American Heart Association was the winner. They were bigger, they were stronger. They believed, Ancel Keys, that the low-fat, high-carb diet was the way to go. High carbs were just a product of low fat. You had to replace one food group with another. And even Dr. Elliot Jocelyn, the god of diabetologists, believed that fat was the cause of heart disease. On the other side, you had Atkins coming around. You had the ADA scientists, but they were beat out by a bigger horse. We picked the wrong horse in 1971. This was a mistake of gargantuan magnitude. The best diet for diabetes and heart disease was considered a low-fat, thus high-carb, thus high-insulin diet. Since inception, this was wrong. It hurt so many. Despite perhaps good and the best intentions, obesity skyrocketed since the 70s. And diabetes exploded, increasing 600%. Okay, in walked Dr. Atkins, cardiologist. You know what he did? He looked back 100 years and said that animal diet seemed to work. He was overweight, he lost weight, he was a smart cardiologist, and he tried it on his patients, and miraculously they got better, they lost weight, he became famous, he was a celebrity, but you know what? He was shunned. He was shunned by the medical establishments. He wasn't one of them. He was called a quack. He was called a fraud. He was maligned. You know what they accused him of? They said there was no science behind his diet. But look at the history that we just gave you. In reality, the saturated fat, cholesterol, heart disease hypothesis had no science. There was no study other than Ancel Keys' flawed report. And then, of course, came out the food pyramid, which was influenced by not scientists or doctors, but more by the food industry and the USDA. So if I had to drill down and say the single most influential nutrition policy ever published was in 1961, right after Ansel Keys' study that the American Heart Association advised to limit saturated fats. This was assumed by the US government and recommended for all Americans in 1980, and this recommendation went worldwide. And like in our first show, there's always a conflict somewhere. And the AHA did have a conflict. If we look, $20 million in today's funds were given from Procter & Gamble. And they produced vegetable oil, Crisco oil, and that was an alternative to saturated fat. That's what margarine was. And you know what? These polyunsaturated fats, vegetable fats, increased 90% from the 70s until today. And if we look at cholesterol reduction, any cholesterol reduction done before statins came up to 30 milligrams showed no difference. Reducing overall cholesterol never showed a difference between total morbidity or cardiovascular disease. Our government institutions, the National Institute of Health, was compliant, but they were fearful of being criticized. They had a study that was contrary to the saturated fat hypothesis. They didn't publish it for 16 years. One of the most famous and respected studies in medicine, the Framingham Heart Study, started in 1948, showed there was no correlation between saturated fat intake and heart disease. That wasn't published for 40 years. The more fat you ate, the lower your cholesterol, and you actually weighed the least amount. But critics in the 60s and 70s, like Atkins, were marginalized. And it wasn't until journalists, not physicians, in the 2000s, like Gary Taubes, came out and proved and brought attention to the fact that fats are not bad for your health. So I think I'll stop there with this episode, and we will come back. There's so much more information. You don't want to miss the second episode, where I give you the answer to weight loss and how to improve your life and live longer. Stay with me.